morning, everybody. Welcome back to my channel, Loving Your Life with Mama D, and I'm Glenda Davis, aka Mama D. Right now, my current situation is I just dropping my husband off at the surgical center to have his knee replacement done. Finally, today. He's been putting it off for a long time. So we're at the Mercy Health Complex in Fairfield, and we're supposed to arrive at 8, which we're about a half an hour early. And then surgery's at 10. Yeah, so we're about to do this. I'm going to take you along with as much of it as I can. All right? This is where it's going to all happen. And here we go. Okay, so we are in here. He's all prepped and getting ready for the nerve block. And the doctor will be ready to take him back in about half an hour or so. Okay, so I decided to come and wait in the car. It's a lot of people in the waiting area. And I have a very good parking space. In fact, I am the first parking space in the front of the building. I mean, I am like not even 50 feet away from the building. The very first spot. So if I move this car, I ain't gonna get this space back, okay? So I'm not going anywhere. I'm just gonna sit here and get some fresh air. And if I need to eat something, I'll go into the hospital and maybe get a bite or something, but I think I'll be okay. They said about an hour and a half. He's all sedated, he's got his nerve block. Dr. Rodney Hauser was just magnificent thus far. He said give him about an hour and a half and he'll be out to talk to me, so. Okay, so he's second from the top, 999. So they started.
Yeah, so he did great.
Okay.
He did get a spinal, so he didn't have to go completely asleep.
Good.
Bad arthritis kind of throughout that entire knee. Wasn't necessarily one spot where it was at its worst, but he was bone on bone kind of throughout that entire knee. So.
For years.
Yeah. So got all the new surfaces in there. He also really had trouble trying to get the knee straight.
Really?
He had a big flexion contracture, but we got him straightened out there. So yeah, he's gonna do great.
Okay, and then what about therapy? So he was gonna start it in the hospital?
Yeah, they'll do therapy with him here. They'll do it today, and then tomorrow morning they'll get him up and get him on stairs and that kind of stuff. And then, as long as he does well with that, then we'll get home a little bit later tomorrow.
Okay, that sounds wonderful. I'm so happy.
Yeah,
so happy.
Yeah, I'm excited
I talked to actually the Gordons are my spiritual parents. So I adopted them. They're so sweet. So I called him and told him he got the biggest laugh. He said, I told him you owed him. He says, yeah, I owe him big time.
Yeah, absolutely.
He was tickled.
I love seeing him. So whenever I see him, he's always smiling and happy.
Always.
And just a great guy.
Always.
So,
yeah. Okay, well, thanks for taking care of my husband.
Absolutely. Yeah,
that didn't even take an hour.
Yeah, the procedure's pretty quick.
Wow. Yeah. Okay.
That means everything went smoothly too, which is awesome.
Good. Okay.
Probably a couple hours. They'll let you know when he moves up to the fourth floor, and then then you'll be able to go up and see him.
All right. Sounds good. Thank you.
All right. Yep, absolutely.
Bye-bye.
Yep.
Okay, so he is in recovery, and we're waiting for a room. So the question right now is if I'm going to be able to go back, or do I need to go over to the hospital side to his floor? How you feel?
A little pain.
But
I'm surviving.
I know that's right. That's
God.
good.
I kind of see how your muscles are working. Can you feel my hand back here? I want you to try to push your knee down onto my hand if you can. Yeah, you're tightening those muscles. There you go. Good. And relax. Good. You do that again. Okay. Go ahead and push down again as hard as you can. Good job. Nice job. Very good. All right, are you able? The next thing is, can you pick this leg up off the bed?
Okay.
Kind of tighten that muscle. Yeah. Okay. Good. Let's try again. So you can go a little higher. Good. Tighten that muscle. I think it's like toes being lifted up off of there. Good. Sometimes what helps is to bend this opposite leg. Let's try a different position. Yeah. Sometimes that helps a little bit too. Okay. So kind of having your foot on the. Go ahead and bend your knee for me. Your foot right here, kind of help. There we go. Now let's try to tighten this and try to lift. There you go. Good. And then slowly control it coming down. Good. So this is just showing us kind of what you got as far as this quadricep muscle kind of working. Just ask if we can unhook that.
Oh, okay.
Yeah. just have to ask them to get disconnected from things. This one, that's your heart monitor. Okay. How's your leg feeling hanging down there?
Not bad. About the same pain.
Okay.
Yeah,
Okay.
no more.
Very good. Let's go ahead and, you mind scooting your left hip out, just straighten yourself out a little. I'm gonna take a look at this leg. Do you have any trouble with your left leg?
No.
Then your feet are on the ground, usually feels better.
Yes.
Okay, good. Go ahead and kick this leg out straight for me. Can you kick it up? Good. Don't let me bend it. I want to see how strong you are. Hold, hold, hold. Very strong. Good. Any numbness or tingling in this left leg?
No.
You got good feeling. Awesome. How's this one feeling? Is it still feeling kind of funny?
Yeah, just a little pain right
Just
there.
up here?
Yeah,
Okay.
right after surgery.
Yeah. You're good. Then I'm just going to have you bend. We'll get you covered.
I'll get you covered up.
Yeah. Okay.
You don't gotta worry about that.
Yeah, don't worry about that. I'm more worried about making sure you feel okay standing there.
And not fall.
And not fall. That's exactly right. So let me take a look at that leg. Good. Nice. Okay. So let's just do a little bit of like, and you kind of, you're okay right where you are. Kind of trying to do weight shifting, putting a little weight.
Does it feel all the way down?
You can, or part of your weight. See how I'm just kind of like shifting my weight forward. Just kind of, you don't have to put all your weight on it. But even just standing, let's just try kind of shifting your weight back and forth a little bit.
Kind of like this, sweetie.
Watch
Yeah,
Joe. There you go. Just kind of get used to putting some weight through there. Yeah. I think you're ready to go. Adele, you were ready to start stepping right there. You feeling okay?
You ready to
You're
go?
not dizzy, lightheaded.
No.
We like to hear that. Okay. So when you turn with these, they still have swivel wheels. When you turn, you're going to pick it up just a little, kind of make it small. Obviously, don't do a 180. Okay. There you go. You're just going to do small turns, little steps with your feet. Okay, and then once you get straightened out the direction you're
There he
going,
goes.
then you can just push straight ahead, and then you're going to go right leg, left leg. That's kind of the pattern. Walker, right, left. That's it. Just take your turn. Take your time turning. You don't ever want to like pivot or twist on that leg, right?
Yeah.
Just, like you're doing it just fine. You're going to take so long.
Look at you go.
I tell you.
You did it right.
I'm ready to go home.
You feel it? Do you feel it in there? Does it feel something? You feel something? Do you feel something in there? Can you tell us in there?
Yeah.
You know?
Pain.
There's a little
Yeah.
pain in there.
Whenever you're ready, I'll put it right here.
Okay.
Awesome.
Yeah. Well, that works out. Good timing.
Surprise, surprise. Well, I got you your covers.
Meloxicam. Have you taken Meloxicam in the past?
Heard of it, but I haven't.
So Meloxicam is an NSAID. It's very similar to ibuprofen, but you take it once a day, and it's for inflammation and it's for pain. So we'll start you on that tomorrow morning with food,
Okay.
and do not take ibuprofen with this medication, okay? Or leave. Just take the Meloxicam. Now we gave you a month's worth of this medication. If you need more, you can take more. You know, or if you need more, just ask for a refill. But yeah. Usually we have you take it for a little while for the inflammation.
Okay.
The third drug is called, the oxycodone is a narcotic. It has side effects. It can make you sleepy, drowsy, nauseous, and very constipated for most
I must have
folks.
took that this morning.
Yeah,
I'm very sleepy.
yeah. It does make you sleepy. So this medication, back as you see fit, okay? Now, oxycodone can be habit forming, so if you don't need it, don't take it. But don't be a hero,
Okay.
okay? If you're having a lot of pain, then take it, okay? It's not a big deal. The thing is there's two things that I care about with the pain control. One, are you sleeping? If you can't sleep, you're not going to heal very well, so get some rest, okay? Sometimes that medicine helps you sleep, you know. I can deal with pain during the day, but at night I can't. So the thing with that is do drink lots of water. You lost some blood in surgery. Everybody does. So I want you to get that volume back up and drink lots of fluids. Okay, that will help balance your system. But yeah, I also wrote down the home care company. We're going to set them up with Summit Home Care. They're going to reach out to you and try to I think I actually told them to call you. So I hope that's okay.
Yeah.
But yeah, they'll try to reach out to you and try to see you tomorrow. And they're going to help you with your therapy. So they should come 2 or 3 times a week for those first 2 weeks. And then usually people can graduate to their outpatient therapy after that. Okay? Alrighty. Then I also wrote my phone number on the front page. So if you have any questions, feel free to reach out to me.
Good.
else restarts tomorrow.
Yeah, yeah.
Except for the aspirin. The aspirin has to be
Yeah.
taken at night.
Okay. How's your pain level feeling now?
It's subsided a lot.
It's come.
Still
Okay.
So I do like to talk to you about a little bit more about pain. So I should tell you that you still have quite a bit of numbing medicine still left in that knee. So it may not feel too bad. I will warn you that will probably wear off tomorrow. Days 2 and 3, so that's tomorrow and the next day, are typically the worst for pain control. I just want to, hey, if you know about it ahead of time, you can plan for it. It may not be a bad idea to stay on top of your pain medicine if you need it. Okay. After the 3 days, it does get a lot better. You just gotta hang in there.
Yeah.
So take the medicine regularly.
We're on our way home. On our way home.